Why 2026 is different. So, why are we talking about this right now in 2026? Because rodent populations across parts of North America, Europe, and South America have surged following a series of unusually mild winters. When rodent populations boom, their territories expand. They move into suburban sheds, crawl spaces, vacation cabins, garages, places that people over 60 often interact with regularly. Gardening, checking on a storage unit, opening up a summer cottage that's been closed all winter. These are all high exposure scenarios, and they're happening more frequently this year. Health agencies have noted a quiet but real uptick in confirmed and suspected cases, particularly in rural and semi-rural areas. And what makes this even more concerning is that most people don't connect their symptoms to a rodent encounter they had 2 or 3 weeks earlier, because hantavirus has a long incubation window, typically between 1 and 8 weeks. By the time someone feels seriously ill, they've completely forgotten about the mouse they saw in the shed. Why older adults are at higher risk? Here's where it gets very specific to you if you're over 60. The immune system changes as we age. That's not a weakness, it's just biology. But what it means practically is that older adults often mount a slower initial response to the virus. And with hantavirus, the speed of that response matters enormously. The virus attacks the lungs by triggering an immune overreaction called a cytokine storm. Your own immune system floods your lungs with inflammatory chemicals trying to fight the infection, and in doing so causes fluid to build up rapidly. Younger lungs with stronger baseline function can sometimes withstand that attack longer. Older lungs, especially in people with existing heart or respiratory conditions, can be overwhelmed much faster. On top of that, many people over 60 take medications, blood pressure drugs, diuretics, medications for diabetes, that can affect how the kidneys and cardiovascular system respond to a sudden severe infection. This doesn't mean older adults are helpless, not at all. It means awareness and early action are more critical for you than for a 30-year-old. The people who survive hantavirus are almost always the ones who recognized something was wrong early and got medical attention before the lung involvement became severe. The symptoms in real language, let's talk about what this actually feels like, because the symptoms in the early phase are genuinely easy to dismiss. The first stage feels almost identical to a bad flu. You get fatigue, the kind where you feel heavy and weak, not just tired, muscle aches, particularly in the large muscles of the thighs and back, fever, sometimes with chills, headache. Some people get nausea, vomiting, or diarrhea, which can make it look even more like a stomach bug. This early phase lasts anywhere from 3 to 7 days, and here's the critical moment. Right around day 4 to 7, some people start to feel slightly better. That brief window of feeling okay tricks a lot of people into thinking they're on the mend. They're not. What comes next in severe cases is the lung phase, sudden shortness of breath, coughing, and a drop in blood oxygen that can escalate within hours. This is the window where people end up in the ICU. Key warning sign to memorize. If you've had any possible rodent exposure in the past 2 months and you develop a flu-like illness with significant fatigue and muscle pain, especially if you start to feel short of breath at all, that is a medical emergency. Don't wait and see. Go to an emergency room and tell them about potential hantavirus exposure. Those words will change how fast you're evaluated. The science behind how it spreads. Now let's go a little deeper into the biology, because understanding this actually changes how you behave. The deer mouse, Peromyscus maniculatus, is the primary reservoir in North America. These mice carry the virus without getting sick themselves. It's been circulating in rodent populations for thousands of years. When an infected mouse defecates, urinates, or nests in an enclosed space, the viral particles can survive in dried material for several days, sometimes longer in cool, shaded environments. When you walk into a dusty shed, sweep out an old cabin, or disturb a rodent nest, you aerosolize those particles. You don't have to touch anything with your hands. You don't even have to see the mouse. A single deep breath in a contaminated space can be enough. This is why closed, rarely visited spaces are particularly dangerous. The dried material accumulates undisturbed, and when you open that door after months away, you're walking into a concentrated environment. Research has also confirmed that bites can transmit the virus, though this is a less common route. The more important path is always respiratory, breathed in, not touched. That single fact shapes every protective strategy we're going to talk about. Common mistakes that put people at risk. Before we get to the practical tips, let's clear up some things that a lot of people get completely wrong, because these mistakes genuinely cost lives. The first one is thinking that regular cleaning is enough. A lot of people sweep out the garage, see some droppings, brush them off a shelf, and consider the job done. That sweeping motion, that's exactly what you should not do. Dry sweeping stirs the dried material into the air and turns it into something you breathe. The correct approach is always to wet the area first before touching anything, which we'll cover in a moment. The second mistake is assuming that if you live in a city or suburb, hantavirus isn't your problem. That thinking is outdated. Deer mice and other carrier species have been documented in suburban neighbourhoods, parks, community garden sheds, storage units, and even attached garages of single-family homes. Urban proximity does not equal safety. The virus goes where the mice go. And the third mistake, maybe the most dangerous one, is waiting to see a doctor because the early symptoms feel manageable. People say, "I'll give it another day or two." The window between early symptoms and severe lung involvement can be very short, especially in older adults. The moment you suspect possible exposure and you develop flu-like symptoms, you go in. You advocate for yourself clearly and say the words, "I may have been exposed to hantavirus." That framing will change your entire care pathway. Practical tips you can act on today. Now let's get into the specific actionable things you can do starting right now. These aren't vague suggestions. Each one has a clear reason behind it. Tip 1, wet before you clean. Anytime you're cleaning a space where rodents may have been, a shed, a basement corner, a garage, a cabin, anywhere, you must wet the area before touching anything. Mix a bleach solution, 1.5 cups of bleach in 1 gallon of water. Spray it directly onto the droppings, nesting material, or contaminated surfaces, and let it soak for at least 5 minutes. This kills the virus before it can become airborne. Then wipe it up with paper towels or disposable cloths and seal them in a plastic bag before disposal. Never sweep dry material, never vacuum it. Wet it first, always. Tip 2, wear the right protective gear. When entering a space you haven't been in for a while or any space you suspect may have rodent activity, wear an N95 respirator mask, not a cloth mask, not a surgical mask, an N95. This specific filtration rating is what blocks the fine aerosolized particles that carry the virus. Pair it with rubber or latex gloves. If you're going to be in there for more than a few minutes, consider disposable coveralls or at minimum old clothes that go straight into a sealed bag after. This sounds like a lot, but it takes 2 minutes to put on and could be the difference between a normal Tuesday and a hospitalization. Tip 3, seal entry points before mice get in prevention is always easier than treatment. Mice can squeeze through a gap the size of a dime, about 6 millimeters. Walk around your home, shed, and garage and look for any gaps where pipes or cables enter the structure, any cracks in the foundation, any space under doors or around vents. Seal small gaps with steel wool packed tightly, then cover with caulk. For larger gaps, use metal hardware cloth or expandable foam with a rodenticide additive. Doing this once a year, ideally before winter when mice seek warmth, dramatically reduces the chance that they set up home in your spaces. Tip 4, ventilate before you enter. If you're opening up a space that's been closed for a while, a vacation home, a storage unit, a basement workshop, open all windows and doors and let it air out for at least 30 minutes before you go in and start working. Fresh airflow dilutes any accumulated particles. If the space has no windows, prop the door open and stand back. The simple act of letting air move through a space for half an hour before you enter it reduces your risk meaningfully. This one costs nothing and takes no equipment. Tip 5, store food in sealed containers. Mice come inside because they're looking for food and warmth. In your garage, shed and cabin, never leave dog food, bird seed, grass seed, or human food in cardboard boxes or open bags. Transfer everything to heavy-duty plastic or metal-sealed containers. This removes the primary incentive for mice to enter and stay. In your home itself, check under the sink and behind appliances where mice sometimes enter seeking water. A mouse that finds no food in your space will move on faster. Tip 6. Set traps strategically, not randomly. If you have signs of mice, droppings, gnaw marks, nesting material, use snap traps as your first line of control. Place them along walls and in corners because mice travel along edges, not across open floors. Wear gloves when handling traps, and when you dispose of a caught mouse, place it in a sealed plastic bag without letting it contact your skin. Glue traps are not recommended because they keep the mouse alive, which means ongoing contamination of the surrounding area. Snap traps kill quickly and are easier to handle safely. Tip 7, know when to call a professional. If you find a large infestation, multiple nesting sites, extensive droppings throughout a space, or evidence of a prolonged rodent presence, this is not a DIY situation. Call a pest control professional. This is especially true in enclosed, poorly ventilated spaces like crawl spaces and attics. Professionals have the protective equipment and decontamination protocols to handle heavy infestations safely. Spending a few $100s on professional remediation is not excessive when the alternative risk is a virus with a 35 to 50% mortality rate. There are still a few important things worth being clear about. There is no vaccine for hantavirus and no specific antiviral treatment proven to cure it. Medical care is supportive, oxygen, sometimes mechanical ventilation, and careful fluid management. That means prevention is not just the best strategy, it's essentially the only strategy. Once someone is in the severe phase, doctors can support the body but cannot fight the virus directly. Everything you do before exposure is what protects you. It's also worth knowing that the virus is not spread person to person, which means if someone in your family gets sick, you cannot catch it from them directly. But if you were both in the same potentially contaminated space, you may both have been exposed. In that case, everyone who was in that space needs to monitor themselves for symptoms for up to 8 weeks. Please, if you take nothing else from this video, take this. The symptoms of early hantavirus look like 100 other things. And by the time it becomes obvious something serious is happening, you may have very little time. If you've been in a space where rodents may have been and you develop a flu-like illness in the weeks after, go see your doctor immediately and mention the possible exposure. Tell them those words directly. And if you have any ongoing respiratory conditions, heart disease, or immune-related health concerns, talk to your doctor proactively about your risk and what signs to watch for in your specific situation. This is one conversation that is absolutely worth having before you ever need it. If this video gave you something valuable today, hit that like button. It genuinely helps this information reach the people who need it most. Subscribe so you don't miss what's coming next. And drop a comment below. Have you ever had a close call with rodents in your home or on a trip. I'd love to hear your story. Coming up next, we're talking about the silent signs of low oxygen in your blood that most people over 60 completely miss, and thing you can do at home to check. You do not want to miss that one.